As people of faith, we envision a society where each person is afforded health, wholeness, and human dignity. That's the vision statement for the Faith Caucus, which brings together people from a variety of faiths to work for healthcare reform. It's part of an organization called Campaign for Better Healthcare. Let's welcome Laura Leon, Director of Faith Initiatives for CBHC. We also welcome Midge Hoff, whose daughter-in-law and unborn grandchild died because they did not have adequate medical care. Thank you to both of you for being here today. Laura, just to set this up, why is this an issue that our young people should be concerned about?
You know, it's a huge issue because if you're looking at young people between the ages of 19 and 30, they actually are the highest population of uninsured. 1 out of 3 do not have health insurance. Let me say that in the state of Illinois, we created a program called the All Kids, which is we are able to offer health insurance for children from 0 to 18. But when they turn 19, then they're no longer eligible for the program. But what's really what we found needed when I was doing that work was the parents are the ones who need coverage. And so that is why we're really working for healthcare reform, because we need a program for everyone. Affordable, accessible, and quality healthcare program for all.
For everybody. Okay, and Midge, your daughter-in-law was a young woman when she faced her trauma. Can you tell us a little bit about her story?
Yes. Jennifer was 24 years old and was 7.5 months pregnant, did not have health insurance, and was struggling along with my son. They had recently moved to another state, and we're looking for an answer about that. And unfortunately, Jennifer got sick, and without access to her primary care physician, had no choice but to go to an ER emergency room. At that emergency room, they gave her a quick checkup. She did tell them they didn't have insurance, and she was sent away, basically, told to see her primary care physician. In less than 24 hours, Jennifer was very ill, and my son he didn't know what to do. So he took her to the next hospital, where they lied and said they had insurance, and that was done out of desperation. They did take her in, they did the appropriate tests on her and found that she was very, very ill. She had septic shock, double pneumonia, respiratory failure, and by that night she was on a respirator and fighting for her life. She was there for 55 days.
What a horrible journey for your family.
Very difficult.
Can you tell us more about why health insurance do you think was an issue in her outcome?
If Jennifer had had preventative health care, it would have never gotten to that stage. She tried to go to the free clinics. The free clinics are overburdened and underfunded, and there's a waiting list. And to apply for Medicaid, that's a 4 to 6 month process. So it was that in-between period of time where there was nothing for her. If there had been a public option, it wouldn't have happened that way. Okay. She would have had access to health care.
That's why the Interfaith Caucus has came together, and we're statewide. It's made of religious leaders from across the state. We have the Islamic tradition involved, the Jewish, Protestants for the Commons Good, UCC, many different denominations involved, because all of our faiths call that we take care of our brother. And we, you know, I come from the Christian faith, and Jesus was a healer, and you know, and so I think all of us have come together to make sure that we do have health care that's affordable, that people can have access for it. What happened to Jen and to Sean and their newborn, the baby, shouldn't have happened, and not in the United States. You know, not anywhere. People should have access for health care, and we're working for a society that we're able to provide health care for all.
The way that Jennifer was treated entering the ER and ending up in a very acute medical situation, Was that the cost-effective way to handle her situation?
Not at all. Not at all, Polly. Her cost was $22,000 a day in ICU, and she was there 55 days, so it was over $1.5 million. And that is passed off to the taxpayers, you know, either higher premiums or taxes. So it is not cost effective at all.
So her life was not saved and money wasn't saved either. It
That's
was
right.
a lose-lose.
That's right.
You know, I just want to talk to the audience. You know, just, you know, your health is so vital to your future, and so by taking care of yourself and going to the doctor and going through preventive medicine, then you don't get into situations where it becomes acute and then it's very difficult to cause. We have women that are dying from breast cancer that if they were caught early and gotten treatment, then they wouldn't lead to their death. You know, so there's many early deaths that we could prevent by preventive care.
Now, Midge, you're a mom. What does being a mom tell you about how our young people are making decisions about healthcare?
I have 5 sons.
Okay.
They were lucky. They all had private health insurance until they were, you know, too old to be on that program. And some of them took it seriously and some of them didn't. And they were lucky. They were lucky because nothing terrible happened to them. Did I ever think that my son and his 24-year-old wife would be in that situation? I never did. And I think that it's so important that parents talk to their children about this and stress the importance of taking health care if it's offered, if not, looking at insurance, you know, independent insurance, whatever they have to do to protect themselves. They are not invincible. And young people
We don't think it will
that.
happen to us.
That's right. It's always the case.
It can happen to anybody. What would your caucus, Laura, say would be included in an ideal reform of healthcare?
Well, our main points that it should be affordable, quality,
Okay.
and it should be accessible. We have areas across the state where we don't have providers, whether it be for private insurance or for public insurance. So we want people to be able to have accessibility so they can get preventive care. What we're looking at in this whole healthcare reform is what's being proposed right now in the Congress is some reforms for insurance companies. We would like to see that insurance companies can no longer exempt people that have pre-existing conditions, that they cannot drop people that get sick. I mean, the whole reason why you get health insurance is because when you might get sick.
Right?
So we would, you know, those are 2 main things that we would like to see around insurance reform. But then we're also looking what we call as the public option or Medicare plus 5, where that if people are unable to buy private insurance, that they would be able to buy into a government program that can offer health insurance. And so that's what our caucus is getting the word out. Actually, we just had recently 198 congregations across the state. They had prayer vigils, discussions, speakers. I know Congressman Jackson came out to one of the churches on the south side, all talking about the importance of acting now, not to wait till next year, because the time is now. We have leadership because we have the president who's saying healthcare, we should make healthcare reform this year. We have faith leaders, we have health leaders, we have community leaders across the country that are, you know, wanting to make healthcare reform. But we have other people who rather put it off because they know putting it off would mean nothing's going to happen. And if nothing happens, then we have more families uninsured and suffering and not getting the health care that they need. And the time is now to act.
Thank you to Laura and Midge for being here today and for all of your hard work. I'm Polly Toner for Different Drummers. Keep the faith.